So talking about TRUUD's approach to evaluation. So this graphic again that shows our where we're focusing our interventions on. So as Dan has said, we are intervening in 7 parts or 8 parts if you listen to Neil. That's probably our kind of internal messaging we need to get clear on, but we have sort of 7 different intervention areas. So intervening in 7 different parts of the system. So we have these 7 interventions being designed, implemented independently from one another, although with some kind of coordination from sort of centrally in TRUUD to kind of think about how they're all linking up. So all of these 7 interventions will be evaluated by the intervention teams who are designing and implementing those interventions. But what we also want to do is to evaluate TRUUD more widely. So sort of think about the TRUUD wide effects of the work and how we as a program have changed, influenced, disrupted the system that we're working in. So I'll try and make this kind of as clear as possible. I think one way to think about it is sort of conceptualizing this as we're evaluating this work on 2 different levels. So firstly, we have these sort of intervention level evaluations. So evaluations of what's happening within each of the interventions. And so someone like myself with a kind of a somewhat traditional sort of public health policy background, we sort of understand this as in a kind of traditional evaluation approaches. So thinking about kind of effectiveness of interventions and then kind of how and why did they work. That's sort of what we've kind of asked each of the intervention teams to do. But then the second layer of this is our kind of TRUUD, what we've called our TRUUD wide evaluation. So thinking about the overall effect of TRUUD interventions on the system, and say these sorts of questions: what are our cumulative effects of our interventions? How have we perhaps and why have we managed to or not managed to change the system? And then thinking further forward, how might we change the system in the future? And that's the sort of the additional layer on this, is thinking about, well, so we are looking for kind of current changes that we can demonstrate now, but then thinking further forward, so 5-10 years down the line, as a result of some of the changes that we might have made in TRUUD, how might we be sort of helping to prevent non-communicable diseases, tackle health inequalities in the future, which is ultimately what TRUUD is all about. So we have a number of sort of research questions for our evaluation. I'm not going to talk through to try and talk through all of them, but I've kind of grouped them into these 3 areas. So we're interested in what impact we had, and as I said, that can be sort of looking for evidence for what impact we've had now, as well as thinking about sort of perceived impacts in the future. Lots of our work is going to be ongoing, I suppose. Those impacts aren't going to have a nice endpoint now. It's going to be something that's going to be continuing. So we can think about what they kind of beyond TRUUD, what those impacts might be, and then how do they sort of map onto, what are the pathways onto having those downstream population health impacts that ultimately we want to have. We're also asking then how and why do we have those impacts? So thinking about trying to explain our impact then, so the sort of facilitators and barriers to TRUUD having the impacts on policy and practice that we hope to have. And then thinking, okay, so what more needs to happen? Yes, we're doing these sort of 7 different interventions, but within those intervention areas and within the wider system, there's an awful lot of other processes, places that we're not intervening. If you remember what something that Dan said right at the start of this, as part of our work, we identified, I think, 50 potential areas of intervention where we could have focused on in TRUUD. We're only taking forward 7 of them. So there's a lot of other sort of areas where we know that work might be needed in the system to help to improve health outcomes ultimately. So kind of a real major part of our evaluation planning has been based around trying to think then, what are these linkages across the different intervention areas in TRUUD? And Neil spoke about the sort of systems mapping work, which is one way that we are able to think about this. And if we change one part of that, if we influence one part of that systems map, how might that affect other parts? And that's been a really helpful way. Another way is sort of thinking about the sort of asking the teams, the TRUUD intervention teams, to think about those sort of interdependencies between intervention areas. So we've done a lot of work, like you won't be able to sort of see the detail in this image, but sort of with the way it works is that the different intervention areas in TRUUD are in the sort of the grey boxes that go sort of diagonally from top left to bottom right. We've asked teams to think about, okay, so if your intervention was to be effective, if it was to be successful, how might that affect the other intervention areas in TRUUD? And similarly, if what's happening in those other intervention areas changes, how would that change the context? Maybe make what we're trying to do in another intervention area more likely to happen or less likely to happen. So getting the different teams sort of think about these potential interdependencies. So just for example, then we might think about we're intervening at national government level as well as sort of city, region and city levels. So we can think about how is a change created at that national level, how might that affect what's happening at city, region or at city level. We might think of it in terms of, well, what further changes need to happen at city region level, for example, in order to kind of to maximise the effectiveness of what we're trying to do at the national level, and the other way around for that as well. So what barriers are there at national level that might be sort of preventing the effective delivery of what we're trying to achieve elsewhere in the system. So these are the sort of questions that we've been able to ask teams and kind of to get a really good idea of what is it we want to try and evaluate, what do we want to understand. So then the stage we're at the moment with this is that the different interventions in TRUUD are kind of at various different stages, but evaluation of those intervention level at the intervention level is sort of ongoing from sort of now through to roughly the end of this year, to 2024. And those intervention level evaluations are taking place fairly independently, with some input from sort of the four of us here today, to sort of embed a bit of sort of systems thinking, a systems lens into some of those intervention evaluations. But in an oversimplified way, by the end of this year, each of those interventions will have been evaluated, and there will be, each of them will have generated data of some sort, and the different evaluations are taking place in different ways, so the types of data are going to be differently. All that data will then be available for our sort of our TRUUD-wide, our systems evaluation. And so in the central column on this slide, I sort of laid out the main steps that we're proposing to take to do this TRUUD-wide evaluation. And this is, you know, I think our thinking is in quite a good place now, but at the same time, there's plenty of room still for this to develop. We're still trying to understand exactly what data is going to be available from the different teams, and as that happens, we'll be able to kind of refine our plans and put a lot more detail on them. But our first stage is going to be really reviewing that intervention level evaluation data with our sort of a systems lens, I suppose. So thinking about these questions on the right hand side, thinking about what are those sort of impacts across intervention areas, how might one affect the other, and what are those interdependencies, and looking for data that speaks to that within those intervention team's own evaluation, which is not necessarily what they're going to be looking at. They're more likely to be focused on the impacts, the outcomes from their own intervention in their own intervention space, rather than necessarily thinking about how that might change the wider system. We then have what we'd like to do is to undertake some more data collection where we identify any gaps. So where teams aren't perhaps identifying these cross-intervention area effects, these cross-system effects, we can then take some more data collection, speak to stakeholders in those areas, and to kind of ask the questions that perhaps haven't been asked so far. We intend to undertake some cross-sector stakeholder workshops towards the end of this process. So that's when we'll look to, we should have an idea around how we think we've impacted on the system, go to those workshops with a number of questions for our stakeholder groups, representing a wide range of stakeholders across the system from the different intervention areas and beyond, and explore those sort of future impacts. We can sort of, using those systems maps, for example, that Neil has developed and showed before, sort of thinking, so if we've had this effect, how might this play out in the future? What might be the sort of the barriers to the impacts you want to have? What else needs to happen next in order to kind of maximise our impacts? Those sorts of forward-looking questions. And just to finish, I thought that there's a number of kind of complexities involved in doing an evaluation like this. I've just got a couple that I think are worth highlighting. Firstly, just the nature of the system, the messiness involved. It's taken us a long time to kind of get the level of understanding that we have, and I certainly don't have a kind of a perfect understanding of what's going on and how it all fits together. And so the complexity of it itself, in terms of then evaluating how we've changed that, is obviously important. There's a particular issue for us that we've battled with since the start of TRUUD around stakeholder engagement. To do our evaluation, we want to talk to the right people who can help us to understand our impacts, but that's often been challenging due to the number of relevant sort of stakeholders and sectors, and who do you speak to at what time, who do you bring in, who will have that good enough understanding of the system to help us to understand what might happen in the future, what might those pathways be towards health impacts. Secondly, then, thinking about these future downstream impacts, we're looking now, our intervention areas, we're all thinking about what's happening in those intervention areas, and then we can look in our TRUUD-wide evaluation about some of how we've changed the system in general. But what we want to do is to understand and then demonstrate really those pathways from what's happening now to what might happen in the future, particularly thinking about how we might be reducing non-communicable diseases. And so, but that obviously comes with a lot of uncertainty. The further forward we look, we want to be able to think about what's sort of happening in the wider context, the sort of political climate, the economic context. And there's a question for us, sort of how can we do this in a way that's going to give us something useful at the end of it, that isn't just we don't know, which is often where I feel. And then finally, I think there's just sort of the practically for us internally, some of the challenges of kind of coordinating and managing a sort of systems evaluation of this nature. The image on the left, this was produced right at the start of TRUUD, and it's probably a lot more complicated now if we were to repeat it with the different people who've come onto the team. But what this shows is the expertise and experience of the TRUUD teams. So people identified into these different sort of categories or disciplines. And you can see this kind of covers the different sort of backgrounds of people that are on the project. And what that means is that everyone's got different ideas about how we should be doing evaluation. What sort of methods to use, what's good practice, what even some of these, what kind of evaluation means, what impact means, all of these sorts of things. And that makes it certainly more difficult to kind of coordinate this. We've had this challenge in many areas, including around evaluation of kind of to what extent do we want to kind of give different teams the sort of the freedom to choose how to do their evaluation and what types of data to produce and when to feed it in, versus some kind of much more coordinated top-down approach, which brings its a whole other load of challenges that those who are familiar with sort of transdisciplinary work and team science will be very familiar with. And then the second point is that, as mentioned, the teams are all naturally more interested, I think, in what's happening within their own intervention area, because that's the world that they're working in. That's maybe their background, and it's certainly where they're focusing a lot of their attention. So if you're working at sort of city council level, and that's the intervention, then prime outcomes for that team are thinking about what's happening in that intervention area at the city council level. How have we changed there? Not necessarily thinking so much about, well, what will happen at national government level if we make this impact at city council level. That's a slightly different way of thinking that I think doesn't come maybe not so naturally. I think Judy was just talking about that's something we should be trying to do in our evaluations, think about those sort of wider system impacts and how it all joins together. But because all of our teams are limited really in time and resources for evaluation, inevitably getting them to kind of to think more about those system-wide effects and bring that into their own evaluations is challenging. And so we'll be interested to see what data comes out of it, I suppose, and then how much gaps there is in terms of what we need to do additionally to understand these wider effects. I'm going to stop there. I think I'm handing back to James, aren't I, for some more Q&A.
No, back over to me. But thank you very much, Geoff and Judy. That was fantastic. Yeah, really great to hear from both of you there. So I'll open it up to the floor.